Diabetes is a chronic disease that affects millions of people worldwide. Unfortunately, it can have devastating consequences if not managed properly. But the good news is that diabetes doesn't have to be a curse. With the right knowledge and tools, you can take control of your health and live a fulfilling life despite this condition. So let's get real about diabetes and discover what you can do to overcome its challenges and thrive. What is diabetes? Diabetes is a chronic medical condition that affects how your body processes blood sugar or glucose. It happens when either your pancreas doesn't produce enough insulin, which is the hormone responsible for regulating blood sugar levels, or the insulin produced by your body isn't effective in managing glucose properly. There are three main types of diabetes: type 1, type 2, and gestational diabetes. In type 1 diabetes, the immune system attacks and destroys cells in the pancreas that make insulin. With type 2 diabetes, your body becomes resistant to insulin or doesn't produce enough of it to maintain normal blood sugar levels. Gestational diabetes only occurs during pregnancy and usually goes away after delivery. The symptoms of diabetes vary depending on its type but can include frequent urination, excessive thirst and hunger pangs even after eating, fatigue or weakness, as well as blurry vision. If left untreated over time, high blood sugars can cause serious health problems such as heart disease, kidney damage, nerve damage leading to amputations, etc. A healthy lifestyle including regular exercise along with proper diet can help prevent and manage some forms of this disease. The different types of diabetes. Diabetes is a metabolic disease that affects the way our bodies use insulin, causing high blood sugar levels. There are different types of diabetes, each with its own causes and symptoms. Type 1 diabetes is an autoimmune disease where the body's immune system attacks and destroys the cells in the pancreas that produce insulin. This type of diabetes usually develops during childhood or adolescence, but can also develop in adults. Type 2 diabetes is characterized by insulin resistance, meaning that the body does not use insulin effectively. This type of diabetes is more common than type 1 and can be caused by genetics or lifestyle factors such as obesity and lack of physical activity. Gestational diabetes occurs during pregnancy when hormones produced by the placenta make it difficult for the body to use insulin effectively. Women who have had gestational diabetes are at increased risk for developing type 2 diabetes later in life. There are also other less common forms of diabetes like monogenic, caused by gene mutations, and cystic fibrosis related, caused by damage to pancreatic cells. It's important to understand which type of diabetes you have so you can properly manage your condition through diet, exercise, medication, or a combination thereof. Regular checkups with your healthcare provider will help ensure proper management regardless of what type you have. The symptoms of diabetes. Diabetes is a chronic condition that affects millions of people worldwide. It can be dangerous if not managed properly, and it's important to recognize the symptoms early on to receive proper treatment. One common symptom of diabetes is frequent urination. This occurs because high blood sugar levels cause the kidneys to work harder to filter out excess glucose, resulting in more urine production. Increased thirst is another common symptom of diabetes. As the body loses fluids through frequent urination, it's natural for individuals with diabetes to feel more thirsty than usual. Fatigue or weakness can also be a sign of diabetes. When cells aren't getting enough glucose due to insulin resistance or lack of insulin production by the pancreas, they may not function as efficiently as they should, leading an individual feeling fatigued and weak. Unintended weight loss can occur in those with undiagnosed type 1 diabetes when their bodies are unable to use glucose from food for energy and instead start breaking down muscle tissue and stored fat for fuel, resulting in weight loss despite eating normally. Other symptoms include blurred vision, slow healing wounds, tingling or numbness in hands or feet, neuropathy, dry skin, recurring infections like thrush, yeast infection, especially among women, etc. It's important to note that some individuals with type 2 diabetes may not experience any noticeable symptoms at all until their blood sugar levels have reached dangerously high levels over time. If you experience any persistent changes in your health status such as increased thirst, frequent urination, weight loss, blurred vision, increased fatigue, recurrent infections, slow healing wounds, etc., consult a doctor immediately. The causes of diabetes. Diabetes is a complex disease that can be caused by many factors. One of the main causes of diabetes is genetics. If there is a family history of diabetes, then you are more likely to develop the condition. Another factor that contributes to developing diabetes is lifestyle choices. Poor diet and lack of exercise can lead to obesity, which in turn increases your risk for developing type 2 diabetes. Processed foods high in sugar and unhealthy fats can also contribute to insulin resistance. Stress is another cause of diabetes as it releases hormones such as cortisol and adrenaline, which increase blood glucose levels. Lack of sleep and poor quality sleep may also contribute to higher blood sugar levels. Certain medications like steroids have been known to trigger type 2 diabetes in some individuals, while illnesses such as pancreatic diseases or hormonal conditions like polycystic ovary syndrome, PCOS, can lead to type 1 diabetes. In summary, while genes play an important role in causing diabetes, lifestyle choices, stress level, medication use, and certain medical conditions all contribute significantly towards its development too. Understanding these risk factors helps us take proactive measures towards prevention or management should one already have this chronic illness. The treatments for diabetes. When it comes to treating diabetes, there are several options available depending on the type of diabetes you have. For those with type 1 diabetes, insulin therapy is a necessity as their body doesn't produce enough insulin on its own. This may involve daily injections or an insulin pump. For those with type 2 diabetes, lifestyle changes such as a healthy diet and regular exercise can help manage blood sugar levels. In some cases, oral medication may also be prescribed by a doctor. Another treatment option for both types of diabetes is continuous glucose monitoring, CGM. CGMs use sensors inserted under the skin to track blood sugar levels in real time and alert individuals when their levels are too high or too low. In addition to traditional medical treatments, alternative therapies such as acupuncture and herbal remedies have also been explored for managing symptoms of diabetes. However, it's important to consult with a healthcare professional before trying any new treatment method. Managing diabetes requires ongoing attention and care. It's important to work closely with healthcare professionals to determine the best treatment plan for your individual needs. The prevention of diabetes. Preventing diabetes is crucial to living a healthy life. While there are some risk factors that cannot be changed, such as age and genetics, there are still steps that can be taken to reduce the chances of developing diabetes. Maintaining a healthy weight through regular exercise and proper nutrition is one effective way to prevent diabetes. This means avoiding high sugar or high carb foods and opting for whole grains, fruits, vegetables, lean meats, and low-fat dairy products instead. Stress management also plays an important role in preventing diabetes. Stress increases blood sugar levels, which can lead to insulin resistance over time. Therefore, it's essential to find ways to manage stress like practicing yoga or deep breathing techniques daily. Getting enough sleep is also critical in reducing the risk of developing diabetes. Lack of sleep causes hormonal imbalances which disrupts glucose metabolism, leading towards insulin resistance. Routine checkups with your healthcare provider can help you identify any potential risks for developing diabetes early on so they can be addressed before it's too late. Conclusion. All in all, diabetes is a chronic disease that can be managed by making certain lifestyle changes. While it may seem daunting at first, with the right mindset and determination, living a life not cursed by diabetes is achievable. By incorporating regular exercise, healthy eating habits, and consistent monitoring of blood sugar levels, individuals with diabetes can live fulfilling lives without compromising their health. It's important to remember that managing diabetes is an ongoing process and requires patience and dedication. If you suspect that you or someone you know may have symptoms of diabetes, don't hesitate to seek medical attention. Early diagnosis and treatment are crucial in avoiding serious complications down the line. In summary, let's get real about diabetes. It's a manageable condition that doesn't have to define your life. With the proper tools and support system in place, anyone can achieve optimal health while living with this chronic disease.